Good evening and welcome to Metrofocus. I'm Jack Ford. One of the most frightening words in the dictionary, or certainly in your doctor's office, is cancer. Here in New York, cancer clusters have alarmed residents of Staten Island and on Long Island, where a heightened number of diagnoses occur year after year. Now, a new initiative has been announced by Governor Cuomo and the State Department of Health to investigate what appears to be these emerging cancer clusters in specific parts of the state. $500,000 has been allocated to conduct the study, with hearings scheduled involving public officials and residents in those communities. Statistics show that 110,000 New Yorkers are diagnosed every year with cancer, with some 35,000 of those succumbing to this deadly disease. Put those numbers into some perspective, get a sense of the importance of this state study, is Dr. Debbie Nampiaparampil, a physician and associate professor at New York's University School of Medicine. Doctor, welcome to you.
Hi, nice to see you.
Let me ask you to start off with this notion of cancer clusters. We hear that term frequently, but medically, what are we talking about when we say cancer clusters?
What you're talking about is whether you're seeing more cancer than you would expect for that location. So, for example, if you're looking at a specific area where you have older patients, people maybe who smoke more, you would expect to see a higher number of people with cancer. But if you don't see those risk factors, then it makes you wonder if there's something else that could be contributing to the increase in cancer. And then you want to find out what that factor might be.
Let me talk about the areas that I mentioned in the introduction here. Staten Island, certain areas of Long Island where there appear to be at least suspicions of this notion of an emergence of cancer clusters. Generally speaking, what types of cancers are we talking about in these areas?
Well, they're talking about leukemia, bladder cancer, thyroid cancer, and also lung cancer. Now, lung cancer is tricky because it's one of the more common cancers that we see in the population, but thyroid cancer is relatively rare. So is bladder cancer. Leukemia can depend on environmental factors too. So the first thing to look at is to see, is there something connected about these cancers? Are these cancers appearing in people who might have other risk factors for having them? Or are we seeing rare cancers appearing more frequently and cancers appearing in, let's say, kids where you wouldn't expect to see it as much?
So obviously, one of the things that the initiative wants to do, and I'll talk about this in a few moments with you, is to focus on that question of why. As of now, do we have any really good, solid, statistically based answers to the questions for some of those types of cancers?
Not yet. Now, sometimes, if you look at risk factors, so for example, smoking and age, if we look at those populations and see, for example, are there a statistically significant number of smokers there compared to other areas? Are people much older? Perhaps do you have, let's say, a cancer hospital there where you might get more people diagnosed with cancer? Then those things might explain those factors, but there has to be a little bit more investigation done first to look into that. They also have to look at ethnicity as another factor. Some things are more common in certain populations. So you want to exclude everything that we already know is a risk factor for those cancers, and then take a look to see what might be left. And that can be tricky as well.
Do we know anything yet about the idea of socioeconomic status and how that might tie into the presence of certain types of cancers?
Well, it is a factor in many different ways. So, for example, people who are in a higher socioeconomic status may have more access to screening, so they can get diagnosed quicker with cancer and then get treated. People of a lower socioeconomic status, usually the cancer has progressed. So in terms of just purely diagnosing it, regardless of whether or not they have it, socioeconomic status can be a factor. The other thing is people who are in a lower socioeconomic status, they may be more likely to have other health habits that can contribute to the development of cancer. So the diet may be more poor, obesity may be a factor in terms of cancer development or certain types of cancer development. People of lower socioeconomic status may be more likely to smoke. So all of these different factors can play a role.
Let me ask you to focus a little bit on the initiative that has been announced here. How will this all play out? First question for you will be, how will this all play out? And second question I'll ask you is what they might hope to find from this. So let's focus first on the process. How do you see this taking place?
Well, I think the first thing they'll do is try to find out who are the people who are being diagnosed with cancer and what do they have in common. So initially, they'll probably look to see what are the ages of these folks? What are their other risk factors for the cancers that they developed? And then if it seems to be that the incidence is higher, then they'll look to see what else do these folks have in common. So for example, if everybody has a similar job, then there might be some type of workplace exposure. If people tended to cluster in other communities or move from one area to another and they seem to have something in common that way, then that can be something that also points you in a certain direction. One of the classic cases is malignant mesothelioma, which is a type of cancer in this sort of barrier between the lungs and the chest and the abdomen. We found out that it's related to asbestos exposure. So what they did was they looked at, what are different workplace exposures that might make you more likely to develop that. And that's how asbestos was discovered as one of the contributing factors.
We like to believe that given the state of medicine today and the science today, that we can find answers to everything. Clearly, that's not so. We know more things than we used to, and we're still looking and learning. But have we seen in the past these areas that we've suspected to be cancer clusters where eventually medical science walked away and said, we just don't know?
Yes, that has happened. Now, sometimes, more often than not, there actually isn't a specific factor that caused the cancer cluster. It could be just from chance, but it's worth investigation, especially if people are in the community are concerned about it. Now, sometimes you'll see something, for example, if it's an area with higher radiation, people are more likely to develop certain cancers. So leukemia is one in that case. But it's important to take a look and just make sure that there is nothing that could be contributing to people developing cancer that we could actually control or treat. Unfortunately, with a lot of these situations, it is so complicated trying to figure out what could have contributed to the cancer that we might not have an answer in the end.
So last question for you. We've described the initiative, hearings that'll take place, what the investigators will be looking for. Generally speaking, what would you anticipate the next step would be once they have accumulated the data?
Well, once they accumulate the data, they're going to look for patterns to see if something could be a factor here. After that, they may tell people that they haven't found a pattern, that they haven't found a specific risk factor, but it doesn't mean that people should completely disregard the information. Obviously, keep up with the regular screening if you live in these areas, be cognizant of certain risk factors for cancer. And if more cases seem to develop, then definitely bring that up once again to your officials so that can be looked at in more detail.
Well, Doctor, I want to thank you for joining us, giving us a sense of all this. I can tell by our conversation you must be a marvelous teacher for your med students there, because you've made it very clear to all of us here what we're looking forward to. Hopefully we'll get you back and we can talk about this a little bit more as it continues. Thank you again for taking the time to talk with us. You be well.
Thank you.